Ladybug Project came about when I was working as a biologist in Africa, and I kept seeing all these schools and clinics that weren't getting help even though they really needed it. These were government schools, private schools, they were just falling through the cracks. But I realized that without advancing education and healthcare, people weren't going to be able to focus on something like the environment until the immediate needs were taken care of. And so I started the Ladybug Project to help alleviate some of the need in these areas. We work in these countries because that's where we have an established volunteer base. We understand the cultures there. I personally have visited and lived and worked in these countries as well. In addition to myself, the Ladybug Project staff is almost entirely volunteer-based. We have 16 staff volunteers. Most of them are part-time and they work within their specialties to help advance the Ladybug Project. In addition to that, we also have over 200 volunteers that are spread across the globe, a lot in our target countries, but also in Europe and South America, who do work long distance for our project. In Madagascar, we are currently undertaking education projects and grant writing to increase our level of education presence there. We have sponsored an urban school in Diego Suarez that is over 1,000 students and grew to be over 1,500 students this last year because of urbanization. We've brought desks to the school, we're bringing supplies to the school. They haven't received much in the form of aid from other organizations at all. For the Diego Suarez School Project, we are hoping to grant write to renovate the school. We will be the first people to renovate the school since the 1960s, and given that they don't receive much aid, and given that they have 1,500 students, it's likely that we will impact several thousand students in the next decade, if not more, who will have the chance to actually go to school in a facility that is not falling down around them. In Equatorial Guinea, the Ladybug Project is currently working with one clinic and 2 schools. We supply them with regular school and healthcare supplies that they don't ordinarily get or that are too expensive to buy in the country. We get these donated by our large network of supporters in the United States and sometimes even in Europe as well. In Equatorial Guinea, it is very difficult to work as a nonprofit unless you have an established network of volunteers on the inside of the country or you're working with a corporation. We are one of the only organizations working in Equatorial Guinea that's not affiliated with a corporation doing education and healthcare work. Ultimately, we hope to create training programs for healthcare providers. We hope to help rural nurses and healthcare providers be better able to serve their populations with increased training in emergency medical care and increased training in general healthcare as well. Youth Aid Foundation to create a volunteer match program, which would be the first of its kind in that area in Ghana. Ultimately, we hope to decrease stigma of the disease, and we also hope to decrease transmission of it by encouraging HIV-positive individuals to be open about their status to a few select people and to keep using contraceptive devices and stop the spread of HIV. We need people to really support this project so that we can get it going, and at the end of the day, in 2 or 3 years, that we have a really good self-sustaining program in Ghana that the Ladybug Project supporters will know we started because of their help. The Ladybug Project wants to keep staying on the cutting edge of innovative social entrepreneurship. We want to keep brainstorming and becoming a think tank of how we can solve some of the problems that we're seeing in our target countries. We want to be the nonprofit that's actually solving problems and not just sending band-aids over to fix them.